Hi guys, Dr. Heather Peterman here. I've got a few minutes of quiet, and so I'm coming to you from my front porch. My kids are playing inside. As many of you, I've been juggling working from home and being in the clinic setting over the last 4 months during the COVID pandemic. And over the last 4 months, I've had a lot of time to really work on my educational pieces. And this is one piece that I've really been wanting to get out there into the world and bring to parents and to providers for quite a while. Even before COVID was an issue, this was a big thing that was on my heart and on my mind because I work with pediatrics. So whether you're aware of it or not, we've been locked in a children's health crisis that's been going on for quite a while in our country. And I don't think that there's a lot of attention on it, and there's not a lot of focus on it because it's kind of taboo and it's kind of scary. We're talking about our children being in danger, and truly with the trends that we're seeing, our kids' health, our kids' mental well-being and their spiritual well-being, along as their physical well-being, are truly in danger because of these trends. And I want to bring awareness to it for acupuncturists who work with pediatrics. I want to give you the tools that you need to start talking to physicians about integrated medicine. And I want to give you the information that you need to start talking to parents about awareness. And if you're a parent watching this video, I want to make you aware of these issues because, like I said, you may or may not even know that they exist. So getting into the nuts and bolts, the meats and potatoes of the situation, really over the last decade, we've seen an increase in pediatric obesity. And pediatric obesity, unfortunately, leads to pediatric chronic pain issues. And pediatric chronic pain issues lead to the prescription of opioids to kids that are fairly young. And this is a big issue. I talk with a lot of pediatricians, I talk with a lot of providers, and unfortunately these kids are truly in a lot of pain and they don't know what to do besides PT and giving them pain medications eventually to bring their pain levels down so that they can participate in their life. So when we talk about getting involved as integrative medicine practitioners, we can talk about addressing the diet and creating an awareness around the lack of nutrition that exists in children's health, and giving parents tools about how to address these things from a nutritional standpoint and start getting this obesity epidemic under control. Get rid of the excessive carbohydrates, get rid of the refined foods, get rid of the excess sugar, and start eating real whole foods in a whole food form where your children can actually get nutrition out of what they're eating. That's going to take a while. It's going to take quite a while to shift this opioid epidemic, or to shift this obesity epidemic. But working with families one at a time and working with pediatricians, we can start to make a difference. The other way that we can address this issue is to get involved with managing pain. So as acupuncturists, what we can offer is a first line of defense, a non-pharmacological intervention to decrease pain, decrease inflammation, and get children feeling better and participating in their life again without the use of opioids. So acupuncture, even when we use it to decrease pain, it's going to help increase well-being and help fight off feelings of depression and feelings of isolation. So it's really approaching pain in a couple different ways that's going to give you a more holistic approach instead of just bringing the symptoms down, but still leaving the child with psychological trauma or psychological issues related to their pain. So we need to start those conversations. And I've given you some really concrete ways that we can start working with this. So we're going to move on to the next issue. And the next issue that I'm afraid that we've been working with is the increase in cyberbullying, the increase in social detachment, and the emotional issues, the behavioral issues and emotional issues, mental health issues that are coming along with an increased digitized world and increased social media presence. Unfortunately, you guys have all seen stories throughout the years of suicides related to cyberbullying or cyberbullying cases that have gotten out of control and children have gotten, unfortunately, it's hard to even say the word, but there's been murders. There's been horrible issues related to these cyberbullying issues. We also see issues, just the whole criminal aspect of being targeted on the internet. So now, over the last 4 months, we've moved into this phase of going completely digital. Children have been removed from their social circles. They've been taken out of those situations where they had a social outlet, and they have an even more pronounced social disconnect where everything is on a digital platform. So I'm really concerned of what this is doing to our child's spirit, or as we call it in Chinese medicine, their shen. What kind of irreversible damage are we creating by allowing them to be in this digital world? And we need to find ways to help reconnect them and ground them and give them real tangible interactions. So that needs to happen outside in their social circles. But what integrative medicine can do, and particularly acupuncture, is to work on their shen and their spirit to help make sure that their spirit and their shen are being nourished, even when they've been removed from these situations. So it'll help combat depression, it'll help combat isolation, and help combat the anxiety and the stress that your children may be going through as we find a way to get back to a norm. So we're going into this time frame where we're talking about whether or not children are going to go back to school, and I don't want to ring in on that. I'm not an educator in the traditional realm, and I don't feel like I have the expertise to say whether or not that's safe. But what I am going to say is that if that happens and this becomes a prolonged issue, that we really need to stay ahead of this with integrative medicine. So that's another piece of the puzzle. And the third piece of the puzzle, as we're moving into navigating these children's health issues, is really, how do we start pulling all of these pieces together? How do we start making a difference? How do we start addressing our children's physical, mental, spiritual needs in a way that helps them feel healthy and grounded and secure? Because we're living in different times. It's not the 1980s, it's not the 1990s. And these kids are dealing with some profound issues that they really shouldn't deal with until later in life. So truly, we need to step up as a profession of acupuncturists and start bringing awareness to these issues. And as a parent, you need to start making some noise and asking for these pieces. Start asking for mindfulness programs in your school. Start asking for mindfulness programs in your institutions, and rely on your local integrative medicine providers. Reach out to acupuncturists who may have ideas, especially those who are advertising that they're working with pediatric health and pediatric wellness, because these things aren't going to get addressed until we start making some noise as a society and as a community. So you can learn more. I've got some resources out there. I have a Purple Elephant education page that I share a lot of information on. I have my Facebook page, Heather Henry Peterman, that you can certainly follow me on. On Instagram, I'm Doc Heather Peterman, so you can follow me there. And then please, if you like what I'm saying and if you want to help get this message out, like my channel here, share it with your friends, subscribe, get the information out there in the world, and let's start talking about and making the conversation around how we can help our children and how we can accelerate this change. And I'm here as a resource to help you. So if you've got some things that you want to address, leave it in the comments or reach out to me, and I'm happy to start working through those issues. Thanks for listening to what I had to say, and please help get this information out there. Thanks, guys.